You're watching CVN, continuing coverage of ESC Congress 2011.
Hello, it's Tony DeMaria again, here with Chris Cannon at the European Society of Cardiology meeting, reviewing the late-breaking clinical trials for CVN. So, of the many trials today, Chris, which ones did you think were particularly interesting?
Well, one that's off topic, but one that we see clinically was a study called CORP that looked at use of colchicine for recurrent pericarditis and found about a 50% reduction in recurrences of pericarditis when adding colchicine. So I thought a very useful randomized trial that we could apply in the CCU.
Yeah, well, interestingly enough, they gave the colchicine for 6 months, and we all know that there's recurrences of pericarditis, and this reduced the recurrences of pericarditis by about 50%. Pretty impressive. I think adding colchicine to the anti-inflammatory regimen is probably something I'll do now in my pericarditis patients. Now, dal-VESSEL, I know you've been involved with anacetrapib. Dal-VESSEL is another CTEP inhibitor that's presented at this meeting.
Well, very exciting data. 2 trials presented. One is a late-breaking dal-VESSEL, in part looking to show no harm, which of course had been seen with torcetrapib, likely an off-target problem with torcetrapib. With dalcetrapib and the dal-VESSEL, they looked at vascular reactivity, saw no differences, so no worsening, and then other metrics of inflammation were also not impacted. Then there's a poster being presented here that's already gone online looking at dal plaque using carotid MRI and found less progression, significantly less progression with the addition of dalcetrapib. It's an agent that increased HDL by a little over 30%, and so some positive news really in the CETP inhibitors. There's a trial ongoing, DAL outcomes, that will look at clinical outcomes, and the other agent, anacetrapib, has just started a randomized trial as well.
Yeah, very interesting, but you know, a surrogate outcome in terms of brachial reactivity, so one we have to be a bit cautious about. And there was an increase in blood pressure. It just didn't attain clinical significance. 31% increase in HDL, that kind of pales compared to anacetrapib, doesn't it?
It is more modest. It's certainly more in the range of what niacin does, and so we'll see whether that can translate into outcomes. And ultimately, we've seen some safety data. Now we need the big trials.
Yeah. Well, one of the studies that was presented was the so-called PURE study, not exactly a clinical trial, but a study of the use of effective therapies throughout the world. And this is a Salim Youssef study. He's certainly done a lot in this. And what he demonstrated was that both in high-income and low-income countries, that there was a surprising reduction in the use of proven therapies, even inexpensive ones like aspirin. Very important. Of course, it was much more marked in low-income countries, and I think it builds upon this concept that there's a lot of low-hanging fruit for cardiovascular mortality in the rest of the world, especially as cardiovascular mortality is becoming more prevalent a cause of disease.
It's exciting to see these global studies that are drawing together the whole world into using the basics as studied here, and then ultimately translating that into good cardiovascular care. So here a call to action in large part that we need to do more to get these simple treatments together.
Yeah. Absolutely, and of course the ASCOT trial, the 10-year follow-up, was interesting in that it showed a sustained 10-year benefit of statins, and the most interesting thing to me was that non-cardiovascular mortality was reduced, particularly infectious disease, so that the role of statins as anti-infectious agents, I think, is going to get more play.
Well, it's definitely intriguing. I think it's not been something we've assessed carefully in trials, and so maybe we need to look specifically at infections in the future trials to try and reaffirm this. It's certainly great news for statins. People have questioned, we don't have the long-term outcomes. Well, now we have yet another long-term outcome study showing a benefit.
Yeah, I'll look forward to the studies that are going to be presented tomorrow. And until then, for CVN, I'm Tony DeMaria, and this is Chris Cannon.